Well, I'm Dr. Sachin Kulkarni, speaking to you from Sunanda Fertility Clinic, attached to Pristine Women's Hospital, Kolhapur. I want to make an interesting point to you that I understand as a consultant in fertility management that most of the couples who are suffering from infertility do not desire IVF. Everybody thinks IVF is something, well, it's a last treatment, it is pretty expensive, it does not guarantee you 100% pregnancy, you have to go through a lot of injections, a lot of physical, emotional trouble, and given a choice, even I wouldn't like to go for IVF. So understanding this, I empathetically feel that as a clinic, we at Sunanda Fertility Clinic should focus more on getting you a pregnancy without an expensive IVF. And that's what is the principal motto. So now we would like to venture about things like how can I achieve a natural pregnancy to you. So I would look at your diet. Have you done those dietetic corrections to achieve a natural pregnancy? Are you having probably sex together frequent enough to achieve a pregnancy? Okay. Do you are really knowing about the whole physiological things, or have you reduced your weight? And something, you feel weight reduction is just eating less. No. There are many more ways to reduce weight. There is about low carb diets, there are strength training exercises, there is also some injections which can do some metabolic corrections and help you reduce faster weight. And what does weight reduction do? And most of the women who ask me, or the men also, how does weight reduction improve fertility? Let me tell you a scientific basis of it. Whenever you reduce weight, you are increasing what is called sex hormone binding globulin. That gets increased secretion from liver. And what does this do? The sex hormone binding globulin is going to bind to all your bad hormones in the body. Like it's going to bind to our progesterone, it's going to bind to testosterone, androstenedione. So all these androgens which are not necessary, or they are increased, and hence you're not probably achieving a pregnancy. That will be bound to, and your hormonal correction will automatically take place. Not only that, because of weight reduction, your pregnancy outcome is better. You suffer less abortions, you suffer less fetal defects, you suffer less problems during the course of pregnancy. So after achieving pregnancy, going to a live birth is pretty easy. So these lifestyle modifications are pretty important. It's not just me, my whole team consists of Dr. Nandita, Dr. Uma, Dr. Swati. We have a physiotherapist with us. We have a special dietitian with us, like Dr. Vinita is there, Dr. Dipali is there, and they're going to sit down with you, explain you bit by bit, and do all the lifestyle corrections, so that something, many a times it is just the lifestyle correction what is necessary, and little saburi, that is, you need to wait patiently and God will gift you a pregnancy. It has happened very frequently to me, wherein the clients have come for PCOS with infertility, patients have come with PCOS resistant cases, going for IVF, and it's just simple weight reduction which has given them good number of pregnancies. So here we at Sunanda Fertility will definitely concentrate on achieving pregnancy without an IVF. The second way of doing that would be giving proper stimulation regimens which have low risk but a good outcome. Just to give you a small glimpse of it, I've seen many of the couples who go through IUI only with clomiphene, or that is fertile, or letrozole. No, clomiphene and letrozole, you can do IUI, but the success is low. The success is as low as just 7%. And not knowing this, couple after couple, years after year, month after month, one keeps on taking the same treatment. But it is the use of injections in ovarian stimulation, so that you develop 2 or 3 eggs, and then we do an IUI, and then your chances are very high. The whole philosophy of an IUI is more eggs and more sperms. So if you don't have more eggs and more sperms, your success is going to be low. So look forward to these kinds of corrections and these kinds of empathetically, emotionally designed treatments. And not just that, they are budget treatments as well compared to IVF. And when you consult us and come to us at Sunanda Fertility Clinic, that would be one of the major targets to achieve pregnancies for you. Again, not needed IVF, but we can achieve pregnancies without IVF as well. Thank you so much.